Hi everyone, I'm Dr. Roman and I'm a blood and cancer doctor, and today we are going to go over hemochromatosis, also known as iron overload. Now, I will be using these two terms interchangeably, and the whole goal of this video is to prepare you, to educate you, so that when you go see your doctor, you can follow along, you know what's going on, and you can ask all those important questions. And as with all my videos, I try to keep it as simple as possible, but providing all that crucial and important information that you need to know. So with that being said, let's get started. Now, my little disclaimer, as always, this video is for educational purposes only. I am not providing medical advice. All right, so let's start off with an overview. The first thing we are going to go over is hemochromatosis, iron, the way it's stored, how much iron is absorbed. I mean, all the details that I think you need to know. Then we're going to go over the symptoms of hemochromatosis. How do we make the diagnosis and ultimately the treatment of hemochromatosis? And there are different types of hemochromatosis, and we will go over all of this. Now, if you see here, I put questions that I would ask. And I'm going to recommend you do one thing. Find yourself a piece of paper and a pen, because throughout this presentation, I will be providing questions that I would have if I was a patient with hemochromatosis. And I want you to think about that. I am a hematologist, and these are the questions that I would ask. So I think that they would be very important for you to ask as well. All right, so let's start off with the definition or defining hemochromatosis. And keeping it simple, it's too much iron in your body. So for whatever mechanism, your body is taking in too much iron, and this iron is being deposited in certain organs. For example, your heart, your liver, your pancreas, your joints, multiple organs. And if you can imagine, if your body is taking in a lot of iron and storing iron in these organs that cannot function normally with very high iron levels, that will lead to problems. Okay, so that's basically what is happening in hemochromatosis or iron overload. Now, I want you to keep in mind that your body absorbs a certain amount of iron per day. For example, in men, about 1 milligram of iron per day. In women, about 1.5 milligrams of iron per day. Now, your body, that's the amount it takes in, and your body can eliminate about the same amount. So 1 milligram per day in men and 1.5 milligrams per day in women. So this maintains balance. It takes in about the same as what it takes out, okay? And that keeps you in what we call homeostasis or balance. Now, if this balance is interrupted, that's what can lead to hemochromatosis. And we're gonna go over all that. All right, so now you know that hemochromatosis is too much iron in your body. And the reason that this can develop is because your body does not have a physiological way of removing extra or excess iron. It takes in a little bit, it takes out a little bit, but if too much iron is coming in, it cannot get rid of it naturally. And that's where you develop hemochromatosis, okay? Now, just know that the majority of iron in your body is in your blood. And this is just a little fact that I want you to keep in mind, especially when we talk about the treatment of hemochromatosis. I just want you to remember that the majority of iron in your body is in your blood. Another little thing that I want you to keep in mind is the word ferritin. Now, ferritin is a protein that stores iron inside of our organs. So for example, ferritin is stored in the liver, the heart, the spleen, the pancreas, our joints. And I want you to keep in mind, because I will be referring back to this word, and I want you to hear it multiple times, because as humans, we learn through repetition, okay? So let's move on. All right, now let's talk about the different types of hemochromatosis. And there are two that I want you to keep in mind. The first one is hereditary hemochromatosis. All this means is that you were born with a gene, okay, a mutated gene that causes your body to absorb more iron than it should. So remember, you're taking in a certain amount of iron, and you're taking out about the same, or you're eliminating about the same amount of iron. Well, imagine if you have a defective gene where you are taking in more iron than what you are eliminating. And I already told you that our body does not have a natural way or a pathway to eliminate excess iron. So in hereditary hemochromatosis, your body is taking in more iron than it can eliminate, okay? And in due time, that will lead to issues with organ function. Now, the other type of hemochromatosis is what we call an acquired hemochromatosis or a secondary hemochromatosis. Now, I'm going to go over this so you understand what I mean here. Acquired means because you developed it later on in life. You were not born with a genetic mutation, okay? Or secondary because it's secondary to something else. And I'll give you an example. So this usually happens in people or patients whom have had multiple blood transfusions. So imagine this. Let's say you have an illness like a hemolytic anemia or sickle cell disease or thalassemia or a myelodysplastic syndrome. These are all disorders where you have significant anemia. So you're walking around with a lot of anemia, you're symptomatic, and your doctor tells you, you know what, we need to give you a blood transfusion. And if you are receiving multiple blood transfusions, remember I told you that the majority of iron in your body is in the blood. So if you're receiving multiple blood transfusions, okay, this will lead to a lot of iron being given to you. And remember, your body cannot eliminate excess iron. So if you receive multiple blood transfusions, you can develop a secondary or an acquired hemochromatosis. Okay, so those are the different types. So the first question to ask if you're watching this video and you're a patient is which type of hemochromatosis do you likely have? Okay, and we're going to go over each one in detail. All right, so let's start off with hereditary hemochromatosis. Once again, you were born with a gene causing a lot of absorption of iron in your intestine, okay? So the neat thing is there's a blood test that your doctor can do to look for this mutation, and it's called the HFE gene mutation. Simple blood test, and it will tell you if you do or if you do not have a genetic mutation. Now, the most common genetic mutations by far are the C282I and the H63D. And this blood test will tell you if you do not or you do have a genetic mutation and which genetic mutation, okay? So simple test, you can ask your doctor and have it done. And if you've had it done, find it and follow along with me. Now, you also have to know if you're heterozygous or homozygous. And I know this sounds complicated, but it's quite simple. Heterozygous means you have one mutation. So one of your two parents gave you that one mutation, okay? Whereas homozygous means you have two mutations, okay? One from your mom and one from your dad. And obviously, homozygous is worse. Usually your body will absorb a lot more iron because you have two mutations. Now there's another rare form which is called a compound heterozygous. That's, for example, when you develop two different mutations. So as an example, you can have one C282Y mutation and one H63D mutation. So you have two mutations, but they're different. That's just, we call that compound heterozygous. So the questions that I would have, okay, if they're suspecting hereditary hemochromatosis is, do I have a mutation? And if so, which mutation do I have? And am I heterozygous, homozygous, or compound heterozygous? I can tell you that heterozygous, by far, having that one mutation is by far the most common. And I also want you to know that most patients that have only one mutation, meaning heterozygous, usually do not develop clinical hemochromatosis. It can, but you usually do not develop so much iron accumulation in your body to actually cause disease. But again, this is something for you to ask your doctor, okay? Just want you to keep in mind, simple blood test, and it will tell you if you do or you do not have a mutation. All right, now let's talk about the other type of hemochromatosis, the acquired or the secondary hemochromatosis that is due to multiple blood transfusions. Now, if you've had 1, 2, 3 blood transfusions, don't panic. You're not going to develop iron overload, okay? This usually happens when you've had 20 or more blood transfusions, okay? So if you have an underlying illness like sickle cell disease, thalassemia, MDS, hemolytic anemia, if you're a patient on hemodialysis, for example, requiring multiple blood transfusions, and you've had 10, 20, 30 blood transfusions, then you can develop this acquired hemochromatosis, and you should ask your doctor to test you for an acquired hemochromatosis. Okay? So a question that I would have is, how many blood transfusions have you had or received? If you've only had 2 or 3, nothing to worry about. Now, if you've had 15, 20, 30 blood transfusions, maybe you do have something to worry about. All right? What about symptoms? And this is quite simple. Wherever the iron is accumulating, depending on the amount of iron, that will cause your symptoms. So as an example, if you get a lot of iron in your liver, and your liver is one of the key players here, your liver is one of the organs that tends to accumulate the most iron. It can lead to liver impairment, ultimately cirrhosis, which is just scarring of the liver, and that could lead to ascites, which is a lot of liquid accumulation in the abdomen. Okay, your abdomen starts to become distended, and you develop jaundice, which is yellowing of the eyes or the skin. So that's one thing that we always monitor for. The other one is your heart. And if a lot of iron starts to accumulate in your heart, you can develop heart failure, okay? So you can develop the shortness of breath, the dyspnea, the fatigue. You walk a little bit and you're constantly short of breath, so things to look out for. It can also accumulate in your pancreas, and you can develop diabetes. It can also accumulate in the skin, okay? You get hyperpigmentation. Your skin starts to become dark in color, like if you have a suntan, for example. And also your joints developing arthritis. And usually the first joints that you start to develop pain on is joints of your first and second fingers. So, it's not always the way that it presents, but I do want you to keep in mind. There's a term that we call bronze diabetes, where we see patients that are diabetic, okay? They tell you, wow, I've developed diabetes, and you look at their skin and they're very tan, okay? It appears as if their skin has a bronze color, and we call that bronze diabetes because of all this iron accumulating on the skin, okay? So it really depends where all this iron is accumulating that will lead to whatever symptoms, okay? All right, so now you're thinking you may have hemochromatosis. So how do we make the diagnosis? And it's quite simple, actually. So the first thing is blood tests. So the first test that I want you to look at is your ferritin. Remember, at the beginning of the presentation, I mentioned ferritin, and that is a protein that stores iron in your body. And it's a blood test. We can measure your ferritin level. And if you're a man and your ferritin level is greater than 300, or a woman greater than 200, you might have early hemochromatosis, okay? Early onset hemochromatosis. Now, if it's very elevated, for example, if your ferritin is over 1,000, then that is highly suggestive of hemochromatosis. So the higher it is, the higher the likelihood you have hemochromatosis. And the greater than 1,000 is important because that's around the range that we start to see the liver damage, the heart damage. So these very high levels start to become worrisome. Now, I put here that ferritin is an acute phase reactant, and I just want to let you know what this means. Ferritin is a protein that if you have inflammation in your body, your ferritin will go up. And a lot of times in my office, I'll see patients sent to me because their ferritin level is high, and the patient is very nervous or anxious, thinking that they may have hemochromatosis, but not necessarily, because a pneumonia, an infection, trauma, recent surgery, anything that causes stress to your body will elevate your ferritin level. So if you've had recent surgery, for example, or you were battling pneumonia, or whatever the case, you had a fracture and you had surgery, that's not the best time to measure a ferritin level, because it can be elevated, not because you have hemochromatosis, but because of the inflammatory process going on in your body. So as an example, if you have pneumonia, it goes up. Once you treat the pneumonia, it goes back down. So the best time to check for ferritin level is not during one of those stressful situations that your body may be going through, okay? So always keep that in mind. So if that's what happened to you, just wait. And once that illness or process resolves, check your ferritin level again, okay? All right, so continuing with diagnosis, let's go over another blood test called your transferrin saturation. Another name for it is your TSAT. Now, transferrin is a protein that carries iron in your body. And if you have a lot of iron within your body, then your transferrin saturation will go up. Think about it. That protein will be saturated, so it goes up. So if your transferrin saturation is greater than 50 in a man or greater than 45 in a woman, it is suggestive of hemochromatosis, okay? Simple blood test, same as ferritin that we use to, tell us, what? This patient likely has an elevated total body iron levels, all right? And last but not least, well, we already went over the genetic testing looking for the C2A2I or the H63D or one of these other genetic mutations. Now, of course, if you're the patient that has had multiple blood transfusions, you're not thinking a hereditary hemochromatosis. You're thinking the secondary or the acquired hemochromatosis. So I wouldn't necessarily be testing you for the HFE gene if you're that patient, okay? All right, now continuing in diagnosis, how do we confirm the diagnosis? How can we tell you 100% yes, your total body iron levels are extremely high? You have hemochromatosis. Well, the first one is doing a biopsy, either in the liver or the heart. Usually it's done in the liver, of course. We don't want to be poking the heart, but they can obtain a little piece of tissue in your heart, and if your iron levels are extremely high, then we say, yes, you have hemochromatosis. Another way to do it, which is done more frequently nowadays, the biopsy was done more in the past. Now we tend to do an MRI scan, and what this does is that it gives us a good measure of iron in the liver or the heart. So you can ask your doctor for this. I want an MRI of the liver, which is mainly the one that's used, or your heart, and it will tell you that according to the radiologist, who's the doctor reading the MRI, yes, you know what? This liver has the appearance, or this heart has the appearance of having a lot of iron within it, all right? So very easy test to perform. So before we move on to treatment, if you're finding value to this video, like the video, share the video, like that other patients can also be helped, okay? And in my channel, I'm constantly coming out with videos such as this in everything cancer related or blood disorder related, trying to really keep it simple because my job here, what I want to do is to educate and help patients out. All right, so now let's move on to treatment. And the first thing I want to let you know is that hereditary hemochromatosis is treated differently from acquired hemochromatosis. So you need to know when we go into treatment now, which one do you have, okay? Were you born with a genetic defect or genetic mutation, or do you have hemochromatosis from multiple blood transfusions? Now, it doesn't matter which one you have. These simple recommendations that I'm going to go over right now apply to both. And that is, for example, rule number 1, avoid excess iron. Be careful. And these are things that I see in my practice, on my day-to-day practice. Avoid vitamins that have high iron levels. When you buy that multivitamin, how much iron does that vitamin have? I cannot tell you how many patients with hemochromatosis are simply taking in vitamins with high iron levels. Be careful. Try, if you can, to limit food that is rich in iron. For example, red meat, liver, spinach. Does not mean that you cannot eat it, but try to just, moderation is key, all right? Also, if you have diabetes or high blood pressure, treat it. You want these things controlled. And what I mean by this, think about it. You have a lot of iron in your body, and that can damage your heart, it can damage your pancreas, it can damage your liver. So you want to try to limit damaging those organs further from something else. Because we know, for example, diabetes is bad for your heart. So you want to really control your diabetes. You want to control your high blood pressure, okay? Because you want to preserve as much organ function as possible. So tell your primary care doctor to be aggressive with you in treating any other illness that you may have, okay? That's another thing. Also, lifestyle changes. Try to maintain a healthy weight. Obesity is not good. Exercise. Limit alcohol. I just told you that all this iron accumulates in your liver, leading to cirrhosis. One of the main causes of cirrhosis is alcohol. So you do not want to be taking in a lot of alcohol. If you have hepatitis C, for example, make sure you get it treated, because a lot of patients with hepatitis C, for example, can be cured. So all this is common sense, okay? So talk to your primary care doctor about this. All right, so now let's talk about specifically hereditary hemochromatosis treatment, okay? You were born with that defective or mutated gene, and the nice thing about this is that if you are treated early, chances are you will have a normal life expectancy. So that's wonderful news, very positive news, and should motivate you to be on top of things. That's the reason I'm making this video. You need to know this so that you can live that normal life, okay? Now, the main treatment is what we call a phlebotomy. Your doctor will send you to your local blood bank or in their office and have blood removed, okay? It's like donating blood. And a lot of times we will remove up to 1 to 2 units a week to get to that lower ferritin levels. Remember, we want to lower your iron levels, and we know that the majority of your iron is in your blood, and that's the reason we are removing this blood. So we want to take out blood we can remove up to 1 to 2 units a week to try to reduce that ferritin level. Now, once we get that ferritin level to where we want it, hopefully less than 100, then we will put you on maintenance phlebotomy, okay? So at the beginning, you had a lot of phlebotomies, and then you may require a phlebotomy every 2 months, every 3 months, every 6 months. It depends the person. Some people take in a lot of iron. Their body just absorbs a lot of iron, and other patients do not take in a lot of iron. So it really depends on your case, how much iron your body accumulates. And as ferritin goes up, we bring it back down. Ferritin starts to go up, we bring it back down. And that's the whole goal, okay? To try to keep your ferritin level normal. Now, typically the goal is keeping your ferritin 50 to 100. Every doctor tends to have their own little go-to number, but that's what we do. So the question that I would have, if you have hereditary hemochromatosis, how much phlebotomy do you need at the beginning to bring down your ferritin levels, and then maintenance to keep that ferritin level at that safe range, okay? So have that conversation with your doctor if you have hereditary hemochromatosis. All right, now let's go over acquired hemochromatosis treatment. So, and I put here hemochromatosis with anemia. Remember, these are the patients that have iron overload because they are getting continuous blood transfusions. So obviously they are anemic. We cannot do a phlebotomy. We cannot remove blood because they have anemia. The same applies if you have hereditary hemochromatosis with anemia, then obviously we cannot do phlebotomy. In these cases, we treat you like this. And in these cases, you will require a medication that will decrease or remove iron from your body. And this is what we call iron chelation, okay? This is iron chelation therapy. And I'm gonna go over 3 of them here with you. The first one is desferoxamine. It's given either subcutaneously, intramuscular, or intravenous. I can tell you patients don't like it very much because you have to constantly be getting these shots. Patients a lot of times self-administer at home. It's multiple treatments, and it starts to get to the point where these multiple shots become painful. So, it does work, but patients do complain. Another one is deferoxarox, and this one works well. It's an effervescent tablet. You basically open the little packet in a drink, and once it disintegrates, you drink it. It does have its side effects. Some patients do complain that they may have issues, while others tell me they tolerate it very well. Another common thing with this is that I've been told it's a little more expensive, so sometimes insurances may not want to cover it, or you may have higher copays. Something for you to discuss with your doctor. Deferriprone is another treatment. This one is a tablet. Now, I just want you to know that one of the main issues with this one is that it can decrease your immune system. So something for you to talk to your doctor about. So if you have hemochromatosis with anemia due to multiple blood transfusions, or if you have hereditary hemochromatosis with anemia where they cannot do phlebotomy, then which iron chelator will you receive? Okay? All right, now this is the last slide, and I really want you to pay attention here. If you have hemochromatosis, you want to know if you have liver cirrhosis, okay? Your liver has so much iron, your liver has been damaged, and you have cirrhosis. And the reason for this is patients with cirrhosis have a higher risk of liver cancer. It's called hepatoma or hepatocellular carcinoma. It's the same thing. It's a type of liver cancer. And if you have hemochromatosis, that increases your risk even further. So if you have hemochromatosis with liver cirrhosis, make sure your doctor is following you, to make sure that you do not develop this tumor. It's what we call screening. We screen you and if all of a sudden we find something in your liver, we want to make sure that's not cancer. So a lot of times we will perform a liver ultrasound and a blood test that's called an alpha fetoprotein, which tends to be high in patients with liver cancer. So we usually perform this every 6 months. And if the liver ultrasound all of a sudden detects a liver mass or your alpha fetoprotein starts to go up, make sure they exclude the possibility of a hepatoma. And if you want to learn more about this, I actually have a video within my channel titled Liver Cancer. If you can see there, it's called hepatocellular carcinoma, where I discuss this particular type of cancer. All right? All right, so there you go. I really do hope you found this helpful. Share the video, like the video so that other patients can also find this video and we can help them out. So all the best to you, and I'll see you on one of my other videos.